Well, welcome to Coffee with Catherine, virtual style. We're so happy to invite our Ladies Auxiliary group and others to learn a little bit about Circle of Life and meet some of our team members. Just a little bit about our Circle of Life Ladies Auxiliary, if you're not familiar with the organization. That group began in 2014 with a small handful of ladies who were passionate about Circle of Life services and the care that we provided to their family members and asked what they could do to give back. Since then, that group has grown to over 500 ladies, and they have raised a significant amount of funds to fund what we call our Angels Paying It Forward, which is typically special things and end-of-life wishes for Circle of Life patients and families. The topic that we're going to cover today during Coffee with Catherine virtually is how hospice is paid for and charity care. A lot of misconceptions are out there about Circle of Life and hospice in general when it comes to payment. A lot of people see the beautiful facilities that we have. They hear about the great care that people come to your home and care for you, and they assume it's very expensive. So today I have invited my guest, Ryan Langston, our Chief Financial Officer, to talk a little bit about how hospice is paid for and the different ways that that's taken care of for all of the patients that we serve. So Ryan, welcome.
Thank you.
Glad to have you today.
Good to be here.
Yeah. So speaking of that misconception that hospice is very expensive, can you talk a little bit about how care is covered for the patients and families that we serve?
Sure. We have several primary sources that pay for hospice care, the largest being Medicare, and that's about 86% of our patients. And the neat thing about the Medicare benefit with hospice is it's included in Part A. And so with Part A, the beneficiary has no out-of-pocket expense. And so for those seniors who come to us with Medicare Part A, their care is completely covered and they have no out-of-pocket expense at all.
And can you talk a little bit about what all is covered? When you say it's 100% covered, what all is included in that coverage?
So the Medicare hospice benefit pays for the physician, it pays for the nursing visits, all the medications, it pays for any medical equipment that they may need, those kinds of things. So basically all the care that we provide is paid for.
Yeah, so they're not going to get multiple bills from multiple different people like when you have a hospitalization or something like
That's
that.
right.
It's typically all covered under the benefit.
You won't get a separate bill for a physician. It'll be included in that same benefit.
Mm-hmm.
Yeah.
Yeah, that's a nice change from
It
a lot of
is.
areas of healthcare.
It is.
Yeah. So as a nonprofit, Circle of Life fundraises every year to cover charity care. Can you speak a little bit to how charity care is used at Circle of Life?
So, one of the values that we have at Circle of Life is inclusion. And that means many different things, but in the finance piece, it means providing care for everyone, regardless of their ability to pay. And so that charity care piece for us is extremely important. And so important that even at the foundation level, we're working on raising money to establish an endowment so that we're always able to provide charity care for our patients who need it. So about 3% of our patients need that help.
Mm-hmm.
Yeah.
Yeah, and in the 28 years that Circle of Life has been in existence, I don't believe we have ever turned anyone away or said we couldn't care for someone because of their lack of ability to pay for those services. Isn't that correct?
That is correct, and I'm very proud of that.
Yeah, should be. Okay, so Ryan, you spoke to the Medicare benefit and how that typically covers everything that people will need when they're on hospice services. Can you touch on the other ways that hospice care is covered?
Sure, yeah, there's two other primary ways that the hospice benefit is paid for, and the other one would be Medicaid. And much like Medicare, Medicaid pays 100% of everything. There's no out-of-pocket expense to the patient for being on our services. And then the third one would be private insurance, which is what some of our patients do have as a payer source. And we were talking a little bit earlier about charity care. Even some of our patients who are on private insurance, they may have a copay or deductible. And so they're eligible for charity care as well with their copay and deductible if they're having a hard time meeting those out-of-pocket expenses.
So pretty much anyone that needs hospice care will get hospice care.
Absolutely. Yeah. We have never turned anyone away.
Yeah, it's a great benefit to the community.
It is. Yeah.
Well, you touched a little bit on charity care. Can you elaborate on sort of the fundraising that Circle of Life is doing around that?
Sure. So Circle of Life Hospice Foundation, that's one of their primary objectives, is to raise money for that charity care endowment. And right now their goal sits at about $5 million. And they're working very hard on it, as you know. And so there's more to come. I think you'll hear more about that in the future. Yeah.
Yeah, that charity care piece is really significant to us as an organization because we do believe strongly that anyone that needs our care and services should have it. One of the charity care stories that's near and dear to my heart is when I was shadowing one of our nurses back in the inpatient unit a couple of years ago, and we had a gentleman that was brought in by the ambulance, and he was homeless. When they brought him in, he wasn't clean. He had a scruffy beard. He was obviously very uncomfortable and in pain, and they put him in a bed, put warm blankets on him, cleaned him up, got him the medications he needed to get him comfortable. And when I went back and checked on him just a short time later, you could just see the peace in him. He was at peace, he was comfortable, and it's just such a blessing that we're able to do those kinds of things as an organization, that we get to care for everyone regardless of their ability to pay for that care or reimbursement source.
Yeah, oftentimes when patients come to us, they've been in the healthcare system for a bit, and they've accumulated a lot of bills, and so when they get here and they learn that their care is 100% covered, that's just a very calming thing for them, and especially for the patients who aren't worried about how their family's going to take care of it after they're gone. So
right, they have enough stress going on, and that's one thing they don't need to add to that. So it's a blessing that we're able to provide that care. Well, thank you again for joining us for Coffee with Catherine. We hope to see you all in person again soon, and I hope you all have a great day. Thanks for joining us.